Good day, everyone. Special thanks to Bernie Siegel and his team for inviting me to speak today. I apologize that I'm not live and in person. I think during this talk you'll figure out why, but I'm excited and honored to be speaking to such an august group. I've met a lot of you in the past, and I've worked with a lot of you in the past as well. My talk today is really as a member of the NFL alumni. I want to talk to you about a very special cohort of patients. The title of the talk is Retired NFL Players, an Underserved and Underrepresented Clinical Trial Cohort. My name is Jaime Garza. I'm a clinical professor of orthopedics at Tulane University School of Medicine and director of their Human Regenerative Cell Trials clinic. I'm also a clinical professor of surgery at the University of Texas Health Science Center in San Antonio, my longtime academic home. I am a former NFL player and as well an NFL alumni member. I'm also a senior medical advisor to the NFL alumni. The NFL Alumni Association is the oldest and most recognized national organization of retired athletes probably in the world. We have approximately 10,000 former players, coaches, administrative staff, executives, some spouses, and cheerleaders, as well as some associate members. The NFL alumni has a dual mission. It's caring for kids. This is by giving back to local youth charities throughout our 40 local chapters throughout the United States, and also caring for our own. And most recently, that's expanded into the healthcare of our own by serving our own members, their families, and the communities that our chapters are located in. More recently, we formed the NFL Alumni Health. NFL Alumni Health is a wholly owned subsidiary of the NFL alumni. Essentially, it was set up to offer informational resources, informational programs, and services for NFL alumni members, their families, and the general public. We felt there was a need to address a lot of the health issues that some of you have read about, most particularly chronic traumatic encephalopathy or CTE, but other issues that are now surfacing and which will be the subject of this talk. As an interesting side note of the NFL alumni, there was a study done in 2022 looking at the ethnic makeup of really the past NFL members. Approximately 56% were of African descent. Approximately 25% of are Caucasian or European descent. Interestingly enough, only 0.4% Hispanic descent, of which I am a member. And the remainder were Pacific Islanders, Asians, and others. Why is this important? Because this is a very diverse group of alumni. We were brought together under the umbrella of the NFL and the game of American football, but we all came from different walks of life. This group of men truly are a band of brothers. We were a band of brothers on the field and continue to be a band of brothers off the field. As the old saying goes, these are friendships that were formed in a crucible. We took care of each other on the field, and we're trying to take care of each other now as we live out the rest of our lives. I think it's important to note that in our literature, there are relatively few well-controlled studies published on the health of ex-NFL players. I hope to give you all a snapshot of this cohort over the next few slides. Probably the longest study has been done at Harvard University, the School of Medicine and School of Public Health. It's the football players' health study. It has been going on for several years. I'm one of the study participants, actually. There have been 58 published research papers from this study. 58 is not a whole lot when you consider the amount of literature that's out dealing with other maladies in the general population. But we do have 58 published research papers exclusively looking at the health of ex-NFL players. 28 of them were in brain health. So this study was begun early on when CTE was in the media and was garnering a lot of attention. Health and wellness, 10 papers. Law and ethics, 7. Heart health, which is now coming to the forefront as this population ages, has 5 publications. There are 5 publications on pain, controlling the chronic pain that many of us suffer, mobility issues, and then sleep, which is also becoming a big issue as this population ages and gains weight. In the publication seen below by Grashow et al., Health Span and Chronic Disease Burden Among Young Adult and Middle-Aged Male Former American-Style Professional Football Players in the British Journal of Sports. This is in 2023. Health span, as described in this paper, means a set period of time where the subject is without disease. And there were 4 diseases that were looked at in this study, 4 chronic diseases. There were almost 3,000 former players under the age of 60 that were studied. The maladies were arthritis, dementia, Alzheimer's disease lumped together, hypertension, and diabetes. These results from the former players were compared to the general public, and the players were matched with people of the same age, race, and body mass index. Interesting findings. They do note in the paper and in the reviews of the paper that most of the clinicians and research personnel, when the players walked in, they generally, quote, looked older than their chronological age when they came in for testing, quotes close. Almost 10 years ahead in aging of the general population. Now, an interesting side note to this is that there was no difference, at least through the football players' health study, in longevity between ex-NFL players and their general public cohorts, but that the ex-NFL players didn't have as good a quality of life for a lot longer period of time. So greater than 20% of the ex-NFL players were diagnosed with arthritis in their mid to late 20s, compared to 5% of non-players. 47% of former players in their 40s have arthritis, compared to 19% of non-players. A significant number. And I know many of you in the audience are working on osteoarthritis and arthritic conditions using cell therapy. This is a cohort that has not been studied extensively. Former players were more likely to have diabetes and high blood pressure in the second half of their 20s. In their late 20s, former players were more likely to have diabetes and high blood pressure. Greater than 12% of former players have hypertension, and approximately 7% have diabetes before the age of 30. This compares to 6.5% for hypertension and 1% for diabetes of men their age, non-players. On average, ex-players had 10 fewer years of health span, meaning disease-free, as compared to the general public. A non-Harvard study published in the Journal of Physical Activity and Health also looked at arthritis. And arthritis in their study was shown to be over 3 times more prevalent in retired NFL players than in the general U.S. population in males under the age of 60. It was thought that this excess of early onset arthritis may be due to the high incidence of injuries in football. So NFL Alumni Health, again, a wholly owned subsidiary of NFL Alumni, was the brainchild of 2 brilliant young men, Kyle Richardson and Billy Davis, who are both retired NFL players. They were both Super Bowl champs. Kyle Richardson was a punter with the Baltimore Ravens. Billy Davis was a wide receiver with the same team and also with the Dallas Cowboys. They have spearheaded this effort and have done a tremendous amount of work. And kudos to both of these guys for really driving this as far as they have in just these few short years. What they've done, and the group that supports them, they've come up with proactive health surveys for our membership. We have several webinars that have been placed on Zoom, particularly during COVID, on health topics that were of interest to the NFL membership. Huddle Up and the Huddle Studies, Huddle Up for Health, is the brainchild of Kyle Richardson and Billy Davis. And I'll discuss that in a little bit more detail in the next slide. But they did a Huddle Up for Obesity with our NFL membership and their families. There was a very interesting huddle study that dealt with heart disease that I'll describe as well in a minute. They have formed a medical advisory board, some really stellar folks. Dr. Lee Rice, sports medicine physician out of San Diego, longtime NFL physician with the San Diego Chargers. Robin Smith, MD, MBA, the founder and president of the Cura Foundation and a professor of medicine at Rutgers, New Jersey campus. Jim Kovach, who I played against in college, is a wonderful NFL linebacker who got his MD and his JD, and he's on staff at UC Davis. And then myself. They've also worked hard on getting corporate sponsorships to help us get these messages out to our membership and get them the help that they need. So the Huddle for Health initiative, this is really the community ambassador arm of NFL Alumni and NFL Alumni Health specifically. What we do is the NFL Alumni Health partners with other corporations or health groups, hospitals, medical associations for community health. You know, the NFL, these ex-NFL players live in these communities where they're either born or they played, and they're really known as local celebrities. People listen to them, particularly our minority players, ex-players. People listen to them. They believe in them. We utilize for this Huddle for Health initiative a hub and spoke model. 40 local chapters are situated throughout the United States, and these former players become educated on the topic and then will engage with the community at community events to help spread the word and about whatever health disease we're talking about and the different treatments that are available and the encouragement of these local community folks to get involved in their own health and to get better. A strong example of this was during COVID. We partnered with the CDC and we did a COVID-19 vaccination awareness campaign, which was very, very successful. The Huddle study here was completed in 2022, and it again was a Huddle for Health initiative. It was a study to assess the risk factors of heart disease in NFL alumni, particularly our minority alumni. The sponsors were NFL Alumni Health and Edwards Life Sciences. The principal investigator was our own Dr. Lee Rice, and we partnered very proudly with the Association of Black Cardiologists, who were boots on the ground when we performed the study. There were 500 participants that represented almost every NFL team during 8 different events. The participants underwent 2 non-invasive heart screening procedures, basically an EKG and an echocardiogram. And we're also able to share information on heart function, heart diseases, how to live a heart-healthy life, essentially coaching our ex-NFL players. The Huddle study, as I said earlier, was concluded in mid-2022. The data, specific data is currently being reviewed for publication, so I can't get into all the specific numbers, but suffice it to say that we had some takeaways from these wonderful events. An interesting note to you all who run clinical trials, there was 100% participation to the completion of a study of all the subjects, and these subjects were ex-NFL players. Interestingly enough, approximately 15% of these participants were urgently referred from that day's study for serious conditions that they were unaware of related to their heart. Minorities, we know, and we've discovered through this Huddle study, are at a higher risk for heart disease. Everyone needs to be more proactive about their heart and risk factors is the message that we sent. On a personal note, I'll give you an anecdote. During Super Bowl, we held another open house, so to speak, panel discussion with a lot of our members discussing different health issues. We did discuss the Huddle study for heart disease as well as the obesity study. But personally, I have to tell you that during that meeting, I had a sense of anxiety that had been with me off and on for several months, and it intensified on that weekend. I just wrote it off as possibly being nervous about speaking, about the length of the day. I'm not sure what it was, but after finishing that panel on that day and listening to particularly the talks by the Association of Black Cardiology leadership, I decided when I got home I was going to go get an examination. Lo and behold, within 7 days, I was under general anesthesia and I had a cardiac ablation for essentially paroxysmal atrial fibrillation. Thankfully, I didn't have a blood clot in my atrium at the time, so things went well. I feel better now, and I'm so very grateful to the NFL Alumni Health Group and that Huddle study. Another huddle up was Let's Talk Obesity. Obesity is a problem in the United States, and particularly in our cohort. There were approximately 1,200 ex-NFL players that took part in this health and wellness survey. The purpose really was to assess current ex-player health and their perceptions regarding weight. Again, anecdotally, I was 30 pounds overweight when I was diagnosed with atrial fibrillation. I'm proud to say that today I'm 25 pounds lighter. There is a need for Let's Talk Obesity, and the players really want help. 93% of our NFL alumni that participated in the study tried to lose weight in the past 5 years, and most were not successful. 70% of our NFL alumni, unsurprisingly, with obesity have one or more associated health problems. And over almost half of the NFL alumni would appreciate advice on the best way to lose weight. And they come to us at NFL Alumni Health for guidance, for advice, and for direction. So to begin to summarize this, the NFL alumni, we had a wonderful time on the football field, and our fans had a wonderful time watching us and enjoying the game. But we're now an aging population with, as you've heard, early onset disease that's been with us for a long time. When most of us played, the ex-NFL players of this group, the salaries were very low. Leaving the NFL, most of us didn't leave with any money. So a lot of the membership struggles to find adequate health insurance, as does a huge portion of the United States. They struggle to find good healthcare providers who actually understand their maladies and their physiology. And a lot of our membership are not aware of the results of studies that affect them as ex-NFL players. And as NFL Health, we're trying to bring that information to them. Also, germane to this week's conference and to you all in the audience, there is a very low participation rate of ex-NFL players in clinical trials that could very well help solve some of these health issues. In particular, there's very little participation in FDA cell therapy trials. I am currently the PI on 4 FDA-approved trials, and I can tell you that I can count on one hand the number of ex-NFL players that have actually participated in these trials, and not for lack of trying. Wake Forest Institute of Regenerative Medicine is moving forward with some progress. Dr. Tony Atala and Dr. Johanna Bolander, a researcher at the Institute of Regenerative Medicine, very recently had an NFL day. They're trying to understand the issues and concerns of this very particular cohort. They invited 30 former players and a head coach to visit, and they talked. They shared issues and concerns and discussed different maladies and their hopes for the future. A lot of them are in chronic pain. A lot of them have debilitating knee joint disease and hip disease. The researchers at Wake Forest are developing a treatment that targets the inflammation in the joint, which many of you in the audience are doing as well. But they're also addressing the damaged cartilage and subchondral bone. As Dr. Bolander stated, there are no long-term solutions available for most of these former pros, and I think we all know that. And some of whom are as young as their early 30s. Remember, the health span just really doesn't exist when they leave the NFL. Dr. Bolander emphasized, I think, what I'd love to emphasize, and I think most in the audience understand as well, that research advances will depend on additional funding. With more funding, the sooner the treatments can then reach the clinic. So how can you all help? Well, reach out to NFL Alumni Health at nflalumnihealth.org. Sponsor trials involving our membership, whether it's knee joint problems, hip joint problems, CTE, heart issues. Sponsor some of our membership for clinical trials. Also, let us know, call the NFL Alumni Health and recommend well-designed and FDA-approved trials that you think may benefit this membership, and this membership in turn is going to help benefit the greater community. Partner with the NFL Alumni for community outreach programs in your local communities through the Huddle for Health program. If you're a corporation, think about corporate sponsorship for this wonderful group of men, women, and their families and their communities. I'd like to personally thank, again, Bernie Siegel and his wonderful team, and all of you in the audience, and thank you from the NFL Alumni Association and its members.